Hi, welcome to the community, and thank you for coming along. For those of you who are new, we are talking about mild cognitive impairment, and for those of you returning, thank you for returning. I want to introduce myself. I'm Brenda Curtwright. I'm a speech language pathologist with 20 years of experience, with most of those years working with patients with mild cognitive impairment. And so today I'm talking about the pros and cons of getting tested for mild cognitive impairment. So I want to say welcome aboard and thank you for joining us. Mild cognitive impairment is a diagnosis received when they have a deficit in one or more areas of cognition. Those areas would include attention, language, memory, executive functioning, or visuospatial skills, while maintaining independently activities of daily living, which would include using the telephone, shopping, doing laundry, preparing food, doing their housekeeping, using transportation, and taking care basically of their finances. So there are several benefits to getting tested. Those benefits would include delaying the progression to a more severe diagnosis, such as dementia or Alzheimer's disease. Those would be a major factor in thinking about getting that testing, especially if a medication or something comes available to treat those conditions, those more severe conditions. Also, there's an increased likelihood of figuring out a diagnosis that might be contributing to mild cognitive impairment, that might be masquerading as a mild cognitive impairment. Diagnoses in the areas of endocrine, metabolic, mood, lifestyle, or even sleep deprivation that could be contributing, that could be treated and reversible. So that would be second reason, another benefit. Another benefit would be being able to address your lifestyle, things like your diet, possibly other areas that would be contributing to your presentation that might look like you could have mild cognitive impairment. Another benefit to getting tested would be knowing that your information helps research develop therapies. So the more people who are being diagnosed is informing the profession and the community, the medical community, that there needs to be more therapies. So it's adding to numbers of helping support providing treatment for this population. And a fourth benefit would be that it can help families prepare for the loved one, or can help you if you're the one prepare your finances and just future living arrangements to help support if you have a diagnosis that is going to be possibly more severe that you couldn't get treatment for, or that treatment didn't work for. And that will just help you prepare for the future, as well as consider all options such as clinical trials. So con number one is that you or a loved one may have apprehension after getting a diagnosis to seek out additional medical services in this area of cognition because of the stigma that you might perceive in the community as far as having a cognitive impairment. Number two would be that you could have a false negative, which would be giving you information that you're not having a decline when you actually are, which could slow down your getting treatment for it, which would just result in a bigger problem in the long run. The third would be a false positive, would be receiving a diagnosis that you have mild cognitive impairment when you really don't, which could lead to some stress, and that might lead to angst when in fact you didn't have to experience that stress. And so I want to underscore here, even though those things can happen, the need for accurate testing is really the remedy to try to offset those problems. So I want to also point out that according to the National Institute of Aging, the Alzheimer's Association, the International Association of Gerontology and Geriatrics, the early detection of mild cognitive impairment is essential. I hope that you're able to benefit from this information, and if you have benefited, I appreciate it if you would like this video, or if you can even share it with someone who you think might benefit from it. But all in all, I want to thank you for joining us today and coming to the community. It's been a pleasure to be with you. Have a great day.